hello everyone. I'm Dr. Justin Ho. I'm a member of the Youth World Society of Pediatric Infectious Disease Group and online portal group. I'm also working as a pediatric infectious disease consultant here in the Philippines, specifically Manila. And I'm a member of the PIDSP, which is the Philippine Infectious Disease Society of the Philippines. So I'm very lucky today and privileged to be in the presence of Professor Emeritus Thisyakorn from the Department of Pediatrics at Chulalongkorn University, Bangkok. So I think this is the oldest university in Thailand, right? And she is also an immediate past board member of WSPID as well as the past president of ASPID. So let us all welcome her today, Professor Emeritus Usa.
Thank you, Dr. Justin Ho. You are perfect.
Yes. How are you? How is everything?
Very good.
Yeah, so I'm just going to ask some questions which are going to be relevant, I think, as a PIDSID, also as pediatricians. No, So we'll go ahead with the first question. Okay, as a WSPID committee member and past president of ASPID, okay, what involvement did you have with WSPID?
Oh, a lot, Justin. Besides being the board member and the representative from ASPID to WSPID, we have the regional societies join the WSPID.
Yes.
And then what I have done, I serve as the International Scientific Committee for several meetings of the WSPID. I'm the speakers for several times. And, when we have the meeting, I don't know whether you have been there too, Justin. The one in Manila in 2019,
Yes.
you were there, is that right?
I've been there, yes. And the one in Africa also.
In Africa, okay, in probably in
Durban.
South Africa, yeah. And then I did the poster walk, and then what else? The presentation of the research work, and then the abstract reviewers, and the one that I love very much is last time when Professor Mark Cotton is the president. He organized to have the book called Blue Book. Justin, have you ever heard about the Blue Book?
I've heard about it during the WSPID, the last WSPID Congress. It's very promising and helpful.
We always heard about the Red Book, but this is the Blue Book. So they gather all the expert pediatric infectious diseases expert from all over the world to have that book. And I don't know whether they are going to launch that book. So this is a lot of work. Justin, would you like to do that too? I hope that you will do it one day.
Yes, one day, but I hope to grab a copy. And I hope that there would be Philippine contributors as well. So we are so grateful to be part.
Sure, there's a lot of contribution from Philippines. Yes.
Thank you very much. I'm sure you've been involved in a lot of things, WSPID, that you've mentioned. You've become a speaker. You've handled a lot of mentoring sessions. But I'm sure in the early years, there have been key challenges as a WSPID committee member. Can you tell us some of these key challenges? What made it difficult? Are there any hurdles along the way that you encountered?
Yes, you know it as well. It's quite difficult at the beginning. Like children, you have to start from a newborn and then grow up.
Yeah.
You need to try to find the way to move forward and then try to make it sustain. So that's why as the ASPID representative, we have tried our best to have our ASPID member to join, to collaborate with the WSPID. So that's why we can get a lot of information from each other. They can learn from us, and we can learn from them too. So this is great. You don't have to go from the beginning. You just go at the right time, right way that they already did a lot of work.
Yes, and I'm sure that maybe in terms of collaboration between ASPID and WSPID, do you have an idea how this collaboration started? I mean, are there also like members in WSPID and ASPID and eventually went into both? What do you have insights on that?
You need to try your best that all the members try to have the networking and then collaboration at the global level to every regional society. At the meeting, you met several people, and at the the abstract presentation and at the poster walk, you can meet several people. You can talk, and then sometime something does happen there, like the research work from a different region. So this is great. It's very easy, not just by email or by some other way of communication, but this you can have the face-to-face meeting, and then you can talk to each other. So that's very helpful.
I think one of the hurdles that maybe as a WSPID member, okay, ever since I started, is really I do think it's communication, because all around the world, I think yeah, we don't know. It's a different time zone. I think you've experienced the same, Professor. Like in terms of reaching out to our colleagues around the world, would it
Hmm.
be some kind of a challenge that you experienced also on your end?
Yes. Okay. You just think that the difference is beautiful, Justin. The bright side.
Yeah,
If,
that's a good
yeah,
perspective.
if everything is the same, yeah, outdoor, yeah. So the difference is beautiful. So you learn from each other, and you try your best to get in touch with all of them. Even with the different culture, different everything. Yeah, but we can learn from each other.
Yeah, I'm sure the
And then
time zones are
like
also
me, like
different.
me,
Like,
I love Philippines very much. I went there for probably 30 times, and I
wow.
love the different cultures and everything, and we can manage to do many things together.
I haven't been in Thailand, but I'm excited.
Yes, please come sometime.
Yes.
Let me know. Just let me know, Justin Ho.
Yes, thank you. So, looking back, what do you think was WISPID's most significant achievement in its first decade? And
I
why
think
was WISPID important for you?
I think not just for me, but for everyone, because there is the advancements in science in every part of the world, which you can share, and then you can go right away to the person who's what in charge of the big project, and then you can join them. So that's very easy. So this is a very good thing that they have some global society that connect to all regional society. Imagine about the Africa. Justin, you've been to Africa, is that?
Yeah.
Yeah,
Yes,
Africa.
I've been there in Durban.
Yeah,
Yeah.
if there's no WSPID, will you go? You may because you are very young. You may like to travel. You may like to travel.
Yeah.
It's easy because you can also have the your work done, and also you can enjoy yourself by seeing something different from your country. Is that right?
Yes. In fact, I think I wouldn't go to Durban at all if I'm just going to travel. So I think one of the convincing factors was I would learn through a WISPID Congress. And
Yeah,
yeah, it was a very significant moment for me also.
yeah. Have you been to South America?
I haven't been.
Yeah. That's also another place. There's a lot of difference between us. But don't worry, just remember what I said. Difference is beautiful. So you can learn from each other, and then you can find some new thing, and then find something that you may be able to do for your country or for the world.
So I think really WISPID has made a significant impact to both of us, especially Professor Usa, who's been there as a member for how many years? Yeah, maybe just a last question in terms of like the challenges significance. Like you're also a member of ASPID. So how did ASPID contribute to WISPID, like as a regional society?
Yeah,
So could you tell
Justin.
us some of these collaborations?
Justin, do you know that our region is the biggest in the world, and we have the most populated children in Asia. Is that right? And then,
Yeah, I do think so.
yeah, this is very important. That how can you get all of them united, and then do something very good for your children, particularly in terms of pediatric infectious diseases. we can do a lot of things, because this is a huge region, and we can connect to each
Yeah.
other. And and then you have to try your best to have all the members connect to the world, and then also try to have them networking with the global level. So that will be very helpful. So the world will be the better place for everyone.
I think being a member of ASPID and like also being a member of WSPID, like being in an Asian society represents like Asians as a whole. And yeah, I think it just distinguishes everyone and the cultural differences. Like you're saying, it's beautiful, it's a nice perspective. So I really like how you take on all of these. Like it's not really the bad challenges, but it's the good side or the positive challenges. So just moving on, okay, as a pediatric infectious disease specialist, I think for how many years? I think 30 years you've been practicing as a specialist. Okay, I'd like to ask that what challenges did you face when you were diagnosing and treating infectious diseases in children, like for example, 30 years ago in the Asia region?
I don't look it as the challenges. I try my best at every time of in the past. In the old day, you don't have that high technology, but you should have a very good clinical what the experience, so you can do it right away. So I think nowadays you have too advanced technology. Sometimes you forget about the very simple clinical parameters. So that's helpful. Sometimes you don't need any technology, but you just see the patient and you know what happened, what they have. So in every period of time, you have to try to find the best out of that time. Don't worry about, oh, you don't have that, you don't have technology, you don't have, oh, but no. With the advanced technology, you have to be very careful, because sometimes with the advanced technology, you forget to do something that is simple,
Yeah,
and you don't
I
have
totally
to.
agree.
Yes, and you
Yes.
don't have to pay anything, by just a simple thing. I think that's very important. So look at the bright
Yeah.
side, Justin. Don't worry.
Yes, I
In the
really like
past,
what you
I
said.
don't mind that I worked in the past. I'm happy, and a lot of experience I gained. And then, okay, if you have the high advanced technology, it's also good too. But you need to use it right, or else waste a lot of money and useless. So you have to make a very good decision.
I like how you said it because before we were diagnosing like infectious disease in a clinical way without any of these advanced technology,
No,
right?
no, we have some simple thing. Justin,
Yeah, just the
a
simple
gram
ones.
stain. Have you ever done that gram stain? I think
Yes,
nowadays you don't do
yes.
it. You still do it. Many places they don't do it. The gram stain.
Oh,
You know the gram
okay.
stain?
Yeah.
You don't know,
Yes, I
Justin. You
do.
are too modern.
Yeah. No,
No,
I've done it.
no,
It's common,
because
yeah.
even the gram stain, somebody did it for you, not you yourself. But in the old day, you have to do it yourself when you do the lumbar puncture, spinal tap. You, you take the sample and you examine it yourself. So that's a lot of experience, but I don't mind. But nowadays it's different. I don't know what happened in Philippines. The central lab took everything. The way that I diagnosed some kind of parasitic disease in the spinal fluid. I take a look in that slide, and I saw something moving there, and then finally we have the parasitologist to confirm that this is some kind of parasite. So that's the first time that we report. Yes.
That's a really good point that what you're saying because really I think based on our observations is that a lot of our technicians, our microbiologists, are the ones doing these diagnostic tests instead of the clinicians. So I think when I rotated before in the Research Institute of Tropical Medicine here, I got the experience of handling specimens, and it was truly memorable for me because during the exams, like what was really I can freshly recall is like the specimen or the gram stain that I remembered. So yeah, that was really a good point. Yeah, so I think we've emphasized a lot, no, in terms of the changes that pediatricians faced like before and compared to the present. But are there any medical breakthroughs or turning points in the infectious disease field that could be influenced by daily practice?
Yes.
What are your insights?
Can I say this? You know, actually, I work mainly on dengue. I don't know whether you know that, Justin. You don't. Yeah,
Yes, I know.
mainly for dengue. But all of a sudden, in 1988, we have the first baby who was born from HIV infected mother that I happened to be the attending. So you need to do your best, because the problem is growing. So we have tried our best to prevent mother to child transmission of HIV, and we are quite success at the national level because we try our best to convince the policy maker that you have to do this, or else in the future you will be trapped by having too many pediatric AIDS. So we are quite
Yeah.
lucky. I believe Philippines also have done that too. Did you? Yes, I think
Yes,
so. Yeah, you,
yes.
you did a lot of prevention. Is that right?
Yes,
Yeah,
yes. We have a lot of dengue cases here, and we're
yeah,
glad to be also having you here all the time
yeah.
as one of our speakers. So, let me move on to the evolution of the pediatric infectious disease as a field. Okay, how do you think, Professor, the field of pediatric infectious disease has changed over the past 30 years, and in what way?
Thailand is different from Philippines. We have less children age group. So that's one of the challenges. The doctor, we can't blame them. So they move to other specialty, but we still have some that join the pediatric infectious diseases. But since we have less pediatric age group, so that's one of the challenges that we have to try our best to solve that problem. But not the Filipinos, because the Filipinos, you still have a lot of children. Is that right, Justin?
Yes,
Yes.
we're populated.
Yes, yes. So that's why it's different,
Yes.
and we are moving to the challenge of demographic change. So we have to do our best. And like dengue, I have done the study for many years, and we have found it shifting in age group, Justin, from pediatric age group to adults, and then the mortality is high. So that's very sad. So you need to convince the internist that you've got to do something to do the prevention. So we have tried to do all the research and then several other things to convince the internists to do their best to do the prevention.
Yeah, that's a very good point in terms of like emphasis on prevention. And what about, Professor? How about the diagnostic tools that were used 30 years ago? What were the laboratories like before? And how long did it take to confirm to have all of these diagnostic
Yeah,
results?
okay, it's simple and then it moving, yeah, moving to the high tech. But you need to learn and then move with them, or else you stay behind. So we learn from each
Yeah.
other, but we are easier. Yeah, like you, Justin, you are from the university, is that right?
Yes.
Yeah, so at the university, they always have the conference. So that's why it's
Yeah.
easy for you to learn. But then the other hospital, like the hospital under the Ministry of Health, they also try their best to have the collaboration with the university and try to have the best knowledge to their doctors. So that's every sector of the society need to collaborate with each other, and then you get the
Yes.
best for your country and then for the world.
Yeah, that's a good point. And how about training and education? Like, what was the training back then in terms of like when you're specializing with pediatric infectious disease? And did you have like the right resources,
Yeah, at,
Professor?
at the beginning, I was trained at the Children's Hospital in Bangkok. That's the only children's hospital. How many children's hospital you have in Philippines, Justin? How many?
I don't have the
Not,
number,
not,
but
not, not just one, no.
yes,
No,
of
not just
course.
one. So I was trained there, and it's the only children's hospital in Thailand. So that's why every cases that they cannot do anything, they will transfer to children's hospital. So I learned a lot. I would say that I learned a lot, even though the work is very hard, but I'm fine. So that's why at the beginning, I was trained there, and then I have a chance to go to the United States. And I went to the States for many times, and then I was trained in the advanced technology. Yeah, I don't know. At that time, the ELISA, you have heard about the ELISA?
yes.
Enzyme link immunosorbent assays. It was something that, very, very modern. In 1983, you were not born yet, huh, Justin?
Yes, I wasn't.
Yes. And then I learned, and then you learn, after that, a while, I have a chance to go to the US CDC in Atlanta. They just start about the molecular technology. See, you learn step by step. So that's why we can learn from them, and then they can learn from us, because sometimes they don't know much about the clinical uh, part, and then some other thing that we do. So that's how we can learn with each other.
Yeah, I think based on your setup, you have like a national children's center in your university. You're the only one, so I think that's very helpful for your practice to see most of these kids who are being treated. But that is for training. But how about for research, Professor? So did it actually exist like 30 years ago?
Yes, sure. Because when I start with Children's Hospital, I have a very good mentor, and she's interested in
Mm,
Reye syndrome. I don't know, you know that, Justin?
yeah, yeah,
Yeah.
yes.
How come? You were not born yet. And then, that's how she asked me whether I would like to join. Yes, I said, why not? And then we have some kind of medicine uh, to uh, to stop the progression of the Reye syndrome. So that's my first research work
Wow.
in Reye syndrome. And then another, I don't know why people like to ask me to help them with the research. Another senior doctor asked me whether I would like to do something on the breastfeeding. Oh, breastfeeding is one of the,
Oh,
yeah, very good.
that's
Yes.
nice.
So we have tried our best to do the study on the breastfeeding, and we have found that the mother who breastfed their babies, we have better lipid pattern in their blood. So this one, the research will encourage the breastfeeding, because it's good for your health too, for the maternal health too, not just for the baby. Yeah. Justin, what is your beginning of the research? Tell me, please.
Before I did a research on brain infections, surgical site infections, and yeah, more of like infectious cases. I also did study the prevalence of brain tumors in children. So most of these were very helpful in our practice. Yeah. So I'm sure you've been mentors in a lot of these researches, but uh, what is your personal advocacy in terms of a research topic or any particular topic that you actually advocate as a pediatric infectious disease
Yes. Yeah.
specialist?
Uh, Justin, since the beginning of my career, because I graduated from Chiang Mai University. Have you been, you haven't been to Thailand? Chiang Mai
Yeah,
is
I
the
haven't
northern
been.
part of Thailand, and it's so beautiful. And then we have seen a lot of Japanese encephalitis patients. I don't know, you know Japanese encephalitis?
Yes, we also have cases here.
I think everyone was now vaccinated, so you don't have any more. Is that right, Justin?
I personally I encounter Japanese encephalitis quite rare, but I have colleagues who handle it. So it's quite also common for some of my colleagues,
Oh, yeah.
especially neurologists.
I did a lot on that, after being the medical student, see a lot of cases. That's very sad. And then finally, we try our best to have the government implement the vaccine for the whole nation. So that's great. But still, dengue, you have a lot of cases and who bleed a lot. I don't know whether Justin, have you ever seen dengue who bleeds a lot?
Yes, all the time, especially during these months.
That's
Yeah.
scary, and even it's even more scary in adults because they have organopathy. So that's why they will have the liver failure, kidney failure, and then oh, they die. That's very very sad.
Yes, you have Japanese encephalitis and dengue as your advocacies. But as we close in to the last question about your own career, Professor, I'd like to ask what advice would you give to new pediatricians or PEDS ID specialists starting their careers today?
Yeah, I think they should look at the bright side. Yeah, don't be what? Don't give up. Do your best. But everything, if it's not turn out to be something that you expect, don't worry. There's a lot of new thing that you can start. No, we will not give up. We will not give up. No, and we do our best. And then you have to try your best to do something that be helpful to your society, to your country, and then to the global level. You can do that, Justin.
How about any advice in terms of training or research that they should pursue?
Yes, in my country, it may be different from yours. Yours much easier because we have the great demographic change. We have seen less pediatric age group, so that's why we have to try our best how to maintain our pediatric infectious diseases training here. But in your country, you still have a lot of chance and opportunity. But to me, I think you should go more on prevention. Do your best on prevention in every aspect. Yeah, for example, like during the COVID-19, you need to try to tell them just a simple thing to put the mask on, to wash your hand very well. Yes, so that's very easy and simple. Then vaccination.
Yes, that's a very good point. So prevention and vaccination.
Yes.
And yeah, just to wrap up, my last and final question is that uh, how about access to resources and information? Do you still encourage pediatricians to actually specialize in infectious diseases, maybe like years from now, 10 years, 20 years? Do you think it would be relevant?
No, I still think that it's that there's you have heard about the emerging infectious
Yes, emerging
diseases.
infectious
Yeah,
disease.
yeah, nothing stays still. So that's why you still have a lot to be done, you know, and not just the emerging infectious diseases. You have heard about the infection control. That's also a
Yes.
very, very important aspect that you need to do, particularly at the hospital level. You have to do your best not to spread the infection. Yeah, and there's a lot of things that you can do.
Yes, actually, I myself experienced it because I graduated during the time of the pandemic. And when I graduated, I think it was emphasized a lot, like in terms of COVID policies or infection control. A lot of these things were emphasized in a lot of hospitals, and they were like hiring a lot of PEDS ID. They needed infectious disease specialists. And I personally think it's really evolving, but yeah, what we were pointing out is like a lot of diseases are emerging, so it's going to be relevant in the near future. So thank you very much, Professor Emeritus USA
Yeah,
Thisyakorn,
salamat po.
for
It has
this
been po.
opportunity
Yeah, salamat po. I
to
hope I see you Sunday.
yes, yes. I personally truly learned a lot from your advice, and yeah, I hope that a lot of pediatricians and future PEDS ID would be enlightened because of this interview. So thank you for the time.
Okay, thank you.